Fellow South Africans, the National Coronavirus Command Council met yesterday to consider the recent rise in infections and the possible impact of Omicron variant. This meeting was followed by meetings earlier today of the President's Coordinating Council, which is attended, as you well know, by our premiers and members of the Coronavirus Council, as well as our metro mayors. There was also a cabinet meeting where a decision was taken that the country should remain on coronavirus alert level 1 for now, and that the national state of disaster should remain in place. In taking the decision not to impose further restrictions at this stage, we considered the fact that when we encountered previous waves of infection, vaccines were not widely available and far fewer people were vaccinated. This is no longer the case. Vaccines are now available to anyone aged 12 and above. They are free, and they're also available at many sites across the country. We know that they prevent severe disease and hospitalization. We also know that the coronavirus will be with us for the long term. We must therefore find ways of managing the pandemic while limiting disruptions to the economy and ensuring continuity. However, this approach will not be sustainable if we do not increase the vaccination rate, if we do not wear our masks, or if we fail to adhere to the basic health precautions. We should all remember that in terms of alert level 1 regulations, there is still a curfew in place from 12 midnight to 4 a.m. No more than 750 people may gather indoors, and no more than 2,000 people may gather outdoors. Where the venue is too small to accommodate these numbers with appropriate social distancing, then no more than 50% of the capacity of the venue may be used. No more than 100 people are permitted at a funeral and night vigils. After funeral gatherings and after tears gatherings are not allowed. The wearing of masks in public places is mandatory, and failure to wear a mask when required remains a criminal offense. The sale of alcohol is permitted according to the regular license conditions, but may not be sold during curfew hours. We will closely monitor infection rates as well as hospitalization over the coming days, and will review the situation in another week. We will then need to determine whether the existing measures are adequate or whether changes need to be made to the current regulations. South Africa, like a number of other countries, is looking at booster vaccines for people who are at greatest risk and for whom a booster may be beneficial. Healthcare workers in the Sisonke trial, many of whom who were vaccinated more than 6 months ago, are being offered Johnson & Johnson booster doses. Pfizer has filed an application to the South African Health Products Regulatory Authority for a third dose to be administered after the 2-dose primary series. The Ministerial Advisory Committee on Vaccines has already indicated that it will recommend a staged introduction of boosters, commencing with the older population. Other people with immunodeficiency, such as those on cancer treatment, renal dialysis, and on steroids treatment for autoimmune diseases, are allowed booster doses on recommendation of their doctors. As individuals, as companies and as government, we have a responsibility to ensure that all people in this country can work, travel, and socialize safely. We have therefore been undertaking engagements with social partners and other stakeholders on introducing measures that can make vaccination a condition for access to workplaces, public events, public transport, and public establishments. Now, these engagements include discussions that we've been having at the NEDLEC level between government, labor, business, and the community constituency, where there is already broad agreement on the need for such measures. Government has set up a task team that will undertake broad consultations on making vaccination mandatory for specific activities and locations. That is, to make vaccinations compulsory for certain locations and certain activities. The task team will report to the Interministerial Committee on Vaccination, chaired by the Deputy President, which will make recommendations to Cabinet on a fair and sustainable approach to vaccine mandates. We do realize that the introduction of such a measure is a difficult and complex issue. But if we do not address this seriously and as a matter of urgency, we will continue to be vulnerable as a people to new variants and will continue to suffer new waves of infection. I would like us to consider this matter very seriously. A number of other countries, even in our own country, a number of companies have made vaccinations mandatory. I'd like a consultation to be engaged in, but I do want us to treat it seriously so that we're able to defend our people. The second tool we have to fight the new variant is to continue to wear our face masks whenever we are in public places and in the company of people outside our households. There is now overwhelming evidence that the proper and consistent wearing of a cloth mask or other suitable face covering over both the nose and the mouth is the best way to prevent transmission of the virus from one person to another. The third tool we have to fight the new variant is the cheapest and the most abundant, and that is fresh air. This means that we must try as much as possible to be outdoors when we meet people outside our household. When we are indoors with other people or in cars, in buses, in taxis, we need to keep the windows open to ensure that air can flow freely through the space. Now, this is what our scientists, our medical personnel continue to advise, and they pass on that advice to us at the National Coronavirus Command Council, which is precisely what I'm doing to all of us tonight. The fourth tool we have to fight the new variant is to avoid gatherings, particularly indoor gatherings. Mass gatherings such as major conferences and meetings, especially those that require a large number of people to be in close contact over extended periods, should be changed to virtual formats. End-of-year parties and these matric year-end raves that young people participate in, as well as other celebrations, should be avoided or postponed. And every person should think twice before attending or organizing such a gathering. Last year, many of our young people attended these matric raves, and they were centers of mass infection. Where gatherings do take place, all the necessary COVID protocols must be closely observed. Every additional contact we have increases our risk of becoming infected or infecting someone else. This is extremely sharp of a rise in infections in a short space of time. If cases continue to climb, we can expect to enter a fourth wave of infections within the next few weeks, if not sooner. This should not come as a surprise. Epidemiologists and disease modelers have told us that we should expect a fourth wave in early December. Scientists have also told us to expect the emergence of new variants. There are several concerns about the Omicron variant, and we are still not sure exactly how it will behave going forward. However, we already have the tools that we need to protect ourselves against it. We know enough about the variant to know what we need to do to reduce transmission and to protect ourselves against severe disease as well as death. The first, which is the most important, we have a powerful tool called vaccination. Since the first COVID-19 vaccines became available last year, we have seen how vaccines have dramatically reduced severe illness, hospitalization, and death in South Africa, and indeed across the world. Vaccines do work, and vaccines are saving lives. Since we launched our public vaccination program in May of this year, over 25 million vaccine doses have been administered in South Africa. This is a remarkable achievement. Fellow South Africans, the emergence of the Omicron variant and the recent rise in cases have made it clear that we will have to live with this virus for some time to come, as I have been saying. We have the knowledge, we have the experience, and we have the tools to manage this pandemic, to resume many of our daily activities and to rebuild our economy. We have the ability to determine the path our country will take. Every one of us needs to get vaccinated. I'm repeating about vaccination because it is the best tool that we have. And I'm also saying to those who are doubtful that vaccines are safe. They've been proven to be so, and they save lives. Every one of us needs to practice the basic health protocols that we've always spoken about wearing masks, washing hands, and all that. Every one of us needs to take responsibility for our own health and the health of those around us. Every one of us has a role to play. We will not be defeated by this pandemic. And I'd like to say tonight that we should not panic. We have to live with this pandemic. We have already started living with it. We will endure, and we will overcome, and we will thrive. May God continue to bless our beautiful country and protect her people. Nkosi sikelele Africa. I thank you.